Welcome back to CBS This Morning. We are hearing from the first two medical workers to get the coronavirus vaccine in America outside the clinical trials. They are ICU nurse, that's Sandra Lindsay. She became the first person to receive the vaccine in this country yesterday. This is a big deal. She is also the director of critical care nursing at Long Island Jewish Medical Center right here in New York. Shortly after that, Dr. Yves Duroseau also got the vaccine, too. He's the chair of emergency medicine at Lenox Hill Hospital right here in New York City, too. They both join us now. Good morning to you both. You know, the big question everybody wants to know right off the bat is how are you feeling? Sandra, start us off. Any side effects, any complications whatsoever? It doesn't seem like it looking at your pretty face and smile.
Good morning, Gail, and thanks for having us on. I feel great this morning, and I just want to put great in perspective for people. And so great is at the injection site on a scale of 1 to 10. My pain level is a 1. And this morning I just took my temperature just, you know, for the hell of it to see what's happening.
And what was it? What was your temperature for the hell of it? What was it?
98.1.
Oh, very good.
And no malaise. I really feel great.
All right, Dr. Yves, how are you feeling?
Absolutely. I second exactly what Sandra said. I feel great, just a little minor soreness at the site of the injection. And otherwise, I don't feel feverish. I have no aches and pains. Everything is feeling great.
Sandra, you know, yesterday I was so struck by your video because you literally applauded in the chair. And I'm wondering at that moment, what were you thinking and why did you want to be one of the first people to get the injection?
Because I think as a healthcare professional, it's my duty to preserve public health. And I see this as a step in the right direction, just a small part of what I can do to put an end to the pandemic. I cheered because I felt a huge sense of relief, not just for myself, but for healthcare workers, essential workers, and everyone that has been doing a yeoman's job with putting an end to this pandemic. So I feel hopeful. I see the finish line. The light is brighter in the tunnel. And I just want to tell people, don't look back. It's like running a race. You look back, you're going to fall behind.
But there is still a lot of skepticism out there. What do you say to people that just think, nope, you guys rushed it, the medical community rushed it too fast and corners were cut?
I think what we have to continue to do is message that the science is behind this vaccination, that this is a new technology. It's different than the old technology that required eggs to grow the vaccinations. And that's why it actually came about more quickly and more efficiently. This is actually great news that's not being picked up. This may actually help us in the future with the development of vaccinations. But I would add that we've been through so much. We just absolutely been through a lot. We're still going through a lot.
Yeah, we're still in it.
Too many lives every day. Yeah. So this is the hope that we have in front of us, and we just have to encourage people to take it.
Yeah, that's what my doctor said to me yesterday. She said, Gail, you have to look at the science. They don't cut corners with the science, and I'm very, very focused on that. And she said, you have to get over this fear of needles. You got to just let that go. Here's the other question. Just yesterday, there was a guy at Costco, I believe, in California who went nuts saying that this is all a hoax, that coronavirus doesn't exist. You two have both lost family members to COVID. The death toll is now well over 300,000. What do you say when you hear that kind of response and considering the work that you do? Sandra?
So we just have to keep educating people that it's real. We've lived it. We continue to see it. And that it's not a hoax. They should listen to the experts, listen to all the healthcare workers who have come on before us to share their story, that it's incredible dark, and it is not a hoax. It is real.
What was the feeling among your coworkers yesterday as they watched you all take the injection, and the conversation yesterday at your respective hospitals?
So they're incredibly proud of us, and I've had people come up to me and say, you know, I was planning to put off and wait, but I was so inspired by your story and your courage and your bravery that I can't wait to get the shot now. I am ready. I am like you. I am ready to put an end to this pandemic.
Well, I have to say this, Sandra, whenever they talk about getting the shot here in this country, your face is the one we'll see. Dr. Yves, any closing comment from you?
Yes, I thank you for this opportunity. One thing that we really have to emphasize is the importance of continuing to do what we've been doing the whole time, and that's wearing our masks, washing our hands, social distancing, and please, please, if at all we could refrain from gathering. This and the combination of taking the vaccination is what's going to get us to the end of this nightmare.
All right. I heard Sandra said it's finally light at the end of a very dark tunnel. We thank you both. We thank you.
Thank you, Gail.
Thank you, Gail.